All right, boys, the plan now is to read through the second text option for your first internal Pututu 751, the unit standard. All right, so you will find this one in the OneNote. It's the Otago University study, Alcohol Use in Adolescence. There is growing and internationally consistent evidence to suggest that the heavy use of alcohol by young people makes substantial contributions to risks of a range of adverse conditions in adolescence. Amongst the adverse conditions that have been documented are the following: increased risks of motor vehicle collisions, injuries, and deaths. The transition to adolescence includes two rites of passage that have consequences of increasing the risk of injury and mortality from motor vehicles. First, over the period of adolescence, the majority of young people begin to use alcohol as part of social activities. For example, estimated from the Christchurch Health and Development Study suggested that by the age of 15, over 70% of young people had reported drinking within the last year, with 30% reporting drinking at least once per month. Second, the onset of drinking behaviours coincides with the age at which a driving licence can be obtained, with 15 being the age for acquiring a learner's licence. The combination of these two events places adolescents at risks of drink driving with the attendant harm of motor vehicle collisions, injury and death. The study was from 2010 or 2012, I think, maybe a little bit later than that. Increased risks of crime. There is now substantial evidence to suggest that disinhibiting effects of alcohol place teenagers at increased risk of a range of crimes, including violence, vandalism, sexual crimes, partner violence, and property crimes. This scientific evidence has been supplemented by growing amounts of video material, public arrest, that has documented the ways in which the misuse of alcohol fuels antisocial behaviours by young people. Increased risks of sexual risk-taking. The heavy use of alcohol is also associated with increased risks of sexual risk-taking, including multiple sexual partners and unprotected sex. In turn, this increased rate of sexual risk-taking is associated with increases in sexually transmitted diseases, pregnancy, and abortion. Mental health problems and suicidal behaviours. There is increasing evidence to implicate the misuse of alcohol in the development of mental disorders such as depression and the development of suicidal behaviours in young people. Victimisation. The social context within which alcohol is consumed means that not only are young drinkers at risk of behaving in at-risk ways, they are also at increased risk of becoming the victims of drink driving and alcohol-fueled crimes. In reviewing the risks associated with teenage drinking in New Zealand, the recent Law Commission's report concludes one of the greatest challenges we face around alcohol is how to reconcile the new evidence of the risks alcohol presents to young people with our cultural norms. Drinking to intoxication is commonly seen in our society as a rite of passage, and drinking to intoxication is not only socially accepted but expected. New research has shown that young people experience more harm per standard drink than older drinkers. The highest risk is for those under 15 years, but there is still an elevated risk of harm per drink for young people up to the age of 25. In addition, the Law Commission notes, it is hard to think of any other lawful products available in our society that contributes to so many social ills. While alcohol misuse is only one of several risk factors contributing to these harms, alcohol distinguishes itself because, like many other factors associated with crime, injury, and social dysfunction, the harmful use of alcohol is a modifiable risk factor. What is the scale of the problem? A number of New Zealand publications have sought to estimate the fraction of young people who are at risk because of the heavy consumption of alcohol. However, different studies have used some different approaches. In studies of younger teenagers, rates of binge drinking have been used to assess the size of alcohol-related problems. For example, the Youth 2007 survey reports 34% of young people aged 12 to 17 engaged in binge drinking in the last month, where binge drinking was defined as drinking more than 5 alcoholic drinks in 4 hours. The New Zealand Mental Health Survey reported a range of measures applied to 16 to 24-year-olds. These measures included assessment of the number of young people engaged in hazardous drinking, as well as those meeting formal diagnostic criteria for abuse and dependence. Te Rahenemu found that 79% of young people aged 16 to 24 drank in the previous 12 months, and 49% of those drinkers drank hazardously in that period. The same study showed that, regardless of drinking status, nearly 17% had never met DSM-4 criteria for alcohol abuse, with 6.5 having met the criteria for alcohol dependence. Wow, that's crazy. These figures clearly suggest that over a third of young New Zealanders are at risk of alcohol-related problems each year because of the binge drinking and/or hazardous drinking. The percentage who will have met formal diagnostic criteria for an alcohol-related disorder by the time they're 25 years of age will be well over 20%. All of these figures are indicative of a large and growing problem with the misuse of alcohol by young people. Given the consequences of the misuse of alcohol by young people for a wide range of outcomes, finding constructive means of regulating the use of alcohol by young people and mitigating the adverse effects of alcohol misuse is a matter of high priority in the area of adolescent policy. What does research tell us about causative factors? There has been extensive research into the factors associated with the use and misuse of alcohol by young people. These factors include the following. Genetic factors. There have been growing evidence from both twin studies and behavioural genetic research to suggest that genetic factors may play an important role in determining individual susceptibility to alcohol use and dependence. Estimates suggest that up to 60% of the variation in alcohol use and dependence may be accounted for by genetic factors. It is likely, that genetic factors interact with environmental influences. So those that are most at risk of alcohol-related problems are both genetically susceptible to these problems and are exposed to social environments that encourage the misuse of alcohol. Socio-demographic factors. There is extensive evidence that suggests higher rates of alcohol misuse amongst certain groups within the population. Males are more likely to misuse alcohol than females, although recent evidence suggests that the gender gap in this area is reducing amongst young people. Young people from socially disadvantaged backgrounds characterised by low family income and socio-economic status are at greater risk. In New Zealand, young Māori have rates of alcohol abuse and dependence that are higher than those of non-Māori. Family factors. A large amount of research suggests that the nature and quality of the family environment plays an important role in predisposing young people to the misuse of alcohol. Factors associated with alcohol misuse by young people include parental alcohol problems, early age of first drink, family dysfunction, childhood maltreatment, and related conditions. Peer influences. Amongst adolescents, peer affiliations play an important role in the development of substance use and abuse, with young people who affiliate with substance-using friends and acquaintances being at increased risk of the use and misuse of alcohol. Access to alcohol. There is extensive evidence to suggest that factors that influence the availability and accessibility of teenagers to alcohol play an important role in the development of alcohol use and misuse in this group. These factors include the price of alcohol, the legal drinking age, the availability of liquor outlets, licensing hours, the enforcement of alcohol laws, and advertising. This research makes it abundantly clear that the ways in which the access of young people to alcohol is regulated can play an important role in influencing rates of alcohol use and misuse in this population. The major conclusions that emerge from research into the causative factors involved in the development of alcohol use and misuse are likely to involve a complex interplay of biological, social, familial, peer, and other factors which combine to determine rates of alcohol use and misuse in the adolescent population. Consideration of these factors suggests that the approaches which focus on regulating the access of young people to alcohol offer the greatest potential for minimising alcohol misuse in this population. Prevention, treatment, and management of alcohol misuse. There is a large and extensive literature on the effective policies for the regulation of alcohol and the prevention, treatment, and management of alcohol-related problems. Increase alcohol taxation. There is consistent evidence from around the world that increasing the taxation of alcohol, and hence the price of alcohol, is one of the most effective methods of reducing alcohol consumption and related harms. This approach has been found to be more effective in reducing heavy drinking and is likely to be effective in reducing alcohol consumption amongst younger drinkers. Regulating the availability of alcohol. There is also strong evidence that regulating the availability of alcohol also has benefits in reducing alcohol consumption and harm. The evidence suggests that by restricting the hours of sale, the times of the day when alcohol is sold, and the location of alcohol sale premises, and similar factors, it is possible to reduce levels of consumption and rates of alcohol-related problems. A form of alcohol regulation that is used widely is regulation of the legal age at which alcohol can be purchased. There is good evidence from US-based research that raising the minimum drinking age to 21 has adequately enforcing the law leads to reductions in alcohol-related harm amongst young people. The regulation of drink driving. A further move that has been shown to be effective in reducing alcohol-related harms is the restrictions on drink driving, including lowering the legal breath alcohol concentration and ensuring that drink driving laws are visibly enforced by the use of checkpoints, random breath tests, and strong penalties. With respect to adolescents, it has been proposed that zero-tolerance policies regarding breath alcohol concentrations are effective in reducing rates of drink driving among those below the legal drinking age. Alcohol marketing restrictions. There is increasing evidence to suggest that restricting alcohol advertising and marketing may have modest effects on drinking in young people. Conversely, there is no evidence the voluntary self-regulation codes by alcohol industries have been successful in reducing rates of alcohol consumption amongst young people. Altering the drinking context. A further strategy that has been found to have modest effects in reducing risks of alcohol consumption and harm is greater regulation and oversight of drinking establishments and alcohol supply outlets to ensure that regulations regarding alcohol consumption relating to the age of supply and levels of intoxication are adequately enforced. Development of effective treatments. The preceding approaches have all relied on changing the policy environment in various ways to reduce levels of hazardous drinking and alcohol-related harms. However, even with the most effective population-level policies, a number of young people will develop significant alcohol-related problems and require treatment and support. There has been a growing research literature on the development of interventions aimed at treating and assisting people with alcohol-related problems. This research has identified a number of treatment approaches as being effective. These include brief interventions aimed at reducing the risks faced by hazardous and high-risk drinkers, cognitive, behavioural, motivational enhancement and related therapies, and mutual aid treatment. Parallel to the development of these interventions, there has been a growing number of best practice guidelines for the development of treatment for adolescent populations with alcohol-related problems. Ta-da!